Today we're going to talk about things that we can do to help decrease a thoracic kyphosis. Now the term thoracic kyphosis is a medical term for a rounding of the upper back. We're seeing this not only in adults nowadays, but in young people who spend time holding onto their cell phone and texting. This is not a position that we want to have for too long because it causes pain and discomfort, oftentimes going across the upper back and as well as the lower back, because the lower back has to work harder to hold our upper back up against gravity. It also will tend to make you fall backwards, being a risk for falls if somebody actually bumps into you somewhere. So one of the things we want to do is focus on the Pilates posture. So we want to make sure that we're going to have the same amount of weight on the front of the foot as the back, on the left foot as the right, and on the inside of the feet as the out of the side of the feet. We want the knees over the feet, the pelvis neither arched nor tucked, the belly in, the ribs up, the chest up, and the shoulders back and down. In one of my previous videos, I go over the Pilates posture in detail. Now with the thoracic kyphosis, sometimes it's not that easy to get a really good Pilates posture. So I'm going to give you a couple hints. First of all, your back is neither arched nor tucked. Oftentimes with a kyphosis, the back is already tucked. So we want to actually, in your case, if we could get, we don't want a severe arch, but a little bit of an arch. We still want to pull our belly up and in. The second thing you want to do and work on a little bit more than your average person is, here's the top of your hips. You want to pull your rib cage up away from your hips. So you might have to exaggerate that a little bit while you're still keeping your belly and your pelvis in the best type of alignment that you can. So now you've got your ribs lifted. You're going to exaggerate this other concept of the string tied to the front of their chest. Think of the string pulling your chest up. And when this happens, it actually pushes your body weight forward onto your toes a little bit. So before you were backwards and the weight was going on your heels, now we're going to draw the belly in, we're going to draw the ribs up, bring the chest up, and then maybe put your weight a little bit more forward so you have the same amount of weight on the front of the foot as the back of the foot. Of course, if you listen to my previous video on diaphragmatic breathing, we're going to use that diaphragmatic breathing in through the nose, exhale through the mouth, to hold that posture in place. Otherwise, we'll probably just revert back to what we were doing. Now for some people, this exercise might be quite easy. If you're a young person, your skeleton has not been set yet, so you have a lot of flexibility, you might be able to work out of this kyphotic posture as long as you keep working on it and building those muscles. As time goes by, the bones become more rigid and you may have gotten into this rounded shoulder pattern and it's much more difficult to make a change. Even if you make a little bit of a change, it could be a 1/2 centimeter or 1/4 centimeter. And if you keep working on it, maybe you'll get a centimeter of change where you're lifting your shoulders, lifting your chest and your shoulders back and down. Now, what else can we do besides working on our posture? When we practice holding that upright posture, you may only be able to hold it up for like maybe 1 or 2 minutes. Maybe that's it. And then your body wants to revert back. So practice the posture whenever you can and just be thinking that it is okay to hold the posture for a few minutes. Over time, you keep practicing, you'll be able to hold the posture for longer and longer periods of time. So now what else can we do to help improve our posture and decrease that roundedness in the upper back? One of the things we want to do is actually elongate the spine and do the diaphragmatic breathing. Now when we do that, it actually opens up the chest. A lot of times with a kyphosis, the shoulders are rounded forward. So we're going to use either a stick or a towel to help elongate the torso and get the air into the lungs. And we want to fill the entire lungs. So we are belly breathing, but we are going to try to get some air into the upper part of the chest. Now the easiest thing is to have like a dish towel. And you can hold the two ends, and we can kind of roll it up a little bit. And take the towel, get your good posture, and we're gently pull on the towel. When we pull on the towel outwards, it acts as a method to activate the shoulder blade muscles. And those shoulder blade muscles, they pull the shoulders back and down. So if you have a kyphosis and you pull on the towel, notice how the back starts to lengthen and lift up. Now you don't want to do too many of these. About 4 to 6 is a good number, especially if you're just starting out, because those back muscles, the shoulder blade muscles, might get a little sore because you haven't been using them that much. So we're going to pull on the towel, we're going to inhale and exhale. When we pull on that towel, you'll feel your belly pull in and you will feel your chest lift with the inhale and exhale. So in this case, we're going to pull on the towel and exhale and inhale first instead of exhale. Normally we might do it the opposite way with the breathing. So we're going to inhale, 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 exhale to release. And how about one more? Inhale, 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 exhale to release. So the chest comes up and the shoulders come back and down. Now you can take that towel and bring it in front of you like a T formation, the letter T, and we're going to pull on the towel and you're going to feel those shoulder blades pulling back and down again. So it's a little pull and release. And we're going to inhale, inhale, inhale. The chest lifts up, the shoulders slide down. Exhale to release. Inhale, inhale, inhale. Exhale to release. We'll do about 3 of each one of these. Inhale, inhale, inhale. Exhale to release. And roll the shoulders, because you can be developing some tension in the shoulders and the side of the neck. So you can do a little side bend in between each exercise and look left and right. Now we're going to take the towel up and we're going to bring it up. Now, if you have a kyphosis, sometimes it's hard to bring your shoulders up all the way. So if I have a little bit of a rounded back and I bring them up, sometimes that's about as far as they're going to go. As we improve our posture and the back is less rounded, you may be able to bring that towel directly over your head. But don't worry, just do the best that you can. As you do this exercise with the towel overhead, remember, try to get your chest over your feet, front of the feet, because we don't want to be back here doing the exercise. We want to be more forward and then doing the exercise. So try to get a little weight into the front of the toes. We're going to inhale, 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 exhale to lower down. So when you bring that towel all the way over your head, you can feel your torso stretching and your feet pushing down. So we're going to inhale, inhale, inhale. And you can feel all that air going into the rib cage all the way up through the whole cylinder of the spine. So let's go ahead and try it one more. Inhale, 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 and exhale to go down. Now, if you still have some pretty good range of motion up there, we're going to bring the towel to the top of the head. If you have increased flexibility, you could bring the towel behind the head. So I'm going to show you how that's done. So we're going to inhale, 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 and you're going to bend your elbows into like a W formation or a touchdown formation. So we're going to exhale to come up, inhale and exhale. Inhale and exhale. And one more, inhale, exhale, and lower down. Roll those shoulders. So that gets more of the upper shoulder blades and at the base of the neck. So I'm going to show you that from the side. Belly in, ribs up, and chest up. We're going to inhale, 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 and we're going to exhale. Now, if you can bring it behind the head. But if you bring it behind the head and you're sticking your neck out, don't do that. Just bring it to the top of the head. Okay? Because if we stick the neck out, it's not really helping us per se. Inhale and exhale. And one more, inhale and exhale. Again, only about 4 repetitions. You can really feel it back here in the shoulder blades. If you do too many, your shoulder blades might be quite sore the next day. Now, the next thing we're going to do is focus on opening up the chest some more. And we're going to do 2 more types of exercises. So one, you can take some of these principles with the towel, and this is like a pole. It could be like a pole, or it could be a corner in a room, and you can put your back against the pole. And you want to bend your knees a little bit, get your feet about 10 or 12 inches away from the wall, and we're going to be neither arched nor tucked. Belly in, ribs up, and chest up. Now you may or may not be able to get your head to go against the corner of the room, or in this case, this is a kind of a pole-like type of configuration. So don't worry about that. Just imagine you're holding a tomato under your chin, and you don't want to squish the tomato. You don't want to drop the tomato. So again, we don't want your head up here. We just want it in line with the body. Imagine your shoulder blades are going to wrap around the pole the best you can, and there can be a little bit of an arch back here. We don't want your back completely flat against the pole. You can bend your knees. Now you can do those arm exercises, bringing the arms up and back down, up, and you can bring it all the way up if you want. And exhale into a V configuration. Inhale to come up. Exhale down. You can make the arms come out and down to the side. We can bring those arms up, out, and around in a circle. And again, we're working those shoulder blade muscles, getting them to pull the spine into a lengthened position. And one more, inhale and exhale. And then roll your shoulders, and then you can push yourself out of that position. Now, once you've been practicing with this upright posture, when you come away from the corner of the wall or a pole, you want to make sure that you're going to keep that posture. So I'm going to push myself away. I've been working on this posture. So I don't want to just revert to what I was doing before. Hold the posture and then practice walking. You can walk in place, or you can walk around your house, because you want to be able to maintain this posture with everything that you do. The last exercise we're going to do is a form of compression of the arms on the wall, but elongation of the spine. So I'm going to turn away from you and put my arms on the wall. You can have varied positions, so I'm going to tell you this first and then I'll demonstrate it. You can have your arms in a W position, and when you do that, it causes your shoulder blades to pull back and down. And then what happens is your chest starts to open up. We're going to keep pulling the belly in, and we do want the back a little arched, not severely, but just a little bit, rather than tucked under. You can, over time, after you've been practicing with the arms like this, you can raise them up a little higher. And as you do that, it makes you work more of the center part of the shoulder blades, whereas down here you're working the lower part of the shoulder blades. And then if you bring the arms up higher, then you're working more of the upper part of the shoulder blades. And then you bring them up even higher, you're going to get the neck and the upper part of the shoulder blades. So the arm position focuses on building the back muscles, from the bottom to the top. But you're only going to do what you feel comfortable and what you feel able to do. Over time, as your spine becomes more flexible and more mobile, you can move the arms up higher. But while we're doing this, just resting on the wall, we're going to breathe, and we want to do the diaphragmatic breathing, and we want this chest to open up. So oftentimes the shoulders are rounded. We're going to breathe in, and the air is going to fill the entire cylinder. So I'll do that right now, and I'm going to turn around, and hopefully you can still see me here. Good. And we're going to have our feet together, arms down by our side. Make sure you're squeezing your hindquarters, pull your belly in, lift your chest up, and pull your shoulders back and down the best you can. Stretch your fingers out, and we're just going to take 3 inhales. So it's going to be inhale, inhale, inhale. So, and exhale. And we'll try one more. Inhale and exhale. Then we can raise the arms a little bit more as we're able. Inhale, 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 and exhale. And a little higher over time as we get better and better at this. Keep pulling down into your shoulder blades. Inhale, 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 exhale. And as we get better and better, inhale, 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 exhale. And finally, this is like your ultimate inhale, 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 and exhale to come down. So those are some activities that you can do to help open up the chest. Whenever you're walking, if you notice that your chest is drooping downwards, then pull your belly in and think about how you're going to lift your ribs up and away from your hip. Your abdomen's going to engage, your hindquarters are going to engage, and you're going to feel that chest lift. Keep practicing it over and over again, and you will start to see a difference.